A group of ill people from COVID-19 were given hydroxychloroquine, which appeared to ease their symptoms quickly, but more research is needed. Cough, fever, and pneumonia went away faster, and the disease seems less likely to turn severe in people who received hydroxychloroquine than in a comparison group not given the drug. The study was small and limited to patients who were mildly ill, not severe cases. But the findings strongly support earlier studies suggesting a role for the drug. Dr. Schaffner said, "I think it would reinforce the inclination of many people across the country who are not in a position to enter their patients into clinical trials, but have already begun using hydroxychloroquine," he said. Previous reports from China and France that the drug seemed to help patients, along with enthusiastic comments from President Trump, have created a buzz around hydroxychloroquine and the closely related chloroquine, which are decades-old drugs used to treat malaria and anti-immune diseases. A resulting spike in demand has led to hoarding and shortages, and left patients who rely on the drugs for chronic diseases wondering whether they will be able to fill their prescriptions. With no proven treatment for the coronavirus, many hospitals have simply been giving hydroxychloroquine to patients, reasoning that it might help and probably will not hurt, because the drug is relatively safe. Don't forget to like, share, and subscribe to the channel, and if you like those videos, please ring that bell. A new study of 62 patients with an average age of about 45 did have a control group, of course. It was conducted at the Renmin Hospital of Wuhan University in Wuhan, China. The patients were carefully chosen to exclude people with medical problems that could be made worse by hydroxychloroquine, like abnormal heart rhythms, certain eye diseases, and liver or kidney problems. Half the subjects, the controls, received just the usual care given to coronavirus patients and have had usual care plus hydroxychloroquine. The usual care included oxygen, antiviral drugs, antibiotics, and other treatments. Their disease was considered mild, even though all had pneumonia that showed up on CT scans. After giving informed consent, they were assigned at random to either hydroxychloroquine or the control group. They were treated for 5 days, and their fevers and coughing were monitored. They also had chest CT scans the day before the study treatment began and the day after it ended. Coughing and fever eased a day or so earlier in the patients who received hydroxychloroquine, and pneumonia improved in 25 of 31 as opposed to 17 of 31 in the control group. The illness turned severe in 4 patients, all in the control group. 2 patients had minor side effects from hydroxychloroquine. One had a rash and another had a headache. Dr. Schaffner cautioned that the result applied only to patients with relatively mild illness, like the ones in the study, and could not be generalized to advanced cases. So, what's the take on this drug? Well, we still don't know. But let's hope scientists all over the world join teams and work to figure this coronavirus out. Stay safe, stay home, thank you for watching,